Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. In this video, we'll discuss about needle stick injury and blood body fluid exposure. Learning objectives. This presentation is designed to assist with the training of staff on sharp management including safety devices. The information related to prevent the needle stick injuries. CDC recommends standard precautions and how to document the report. What is needle stick injury? Injuries from needles used in medical procedures are sometimes called needle stick or sharp injuries. Sharps can include other medical supplies such as syringes, scalpels and lancets and glass from broken equipment. What infections can be caused by sharp injuries? Sharp injuries can expose workers to a number of blood-borne pathogens that can cause serious or fatal infections. The pathogens that pose the most serious health risk are hepatitis B virus, hepatitis C virus, and human immunodeficiency virus, the virus that causes AIDS. What to do if you have needle stick injury? You have to follow these 4 steps. Bleed it, wash it, cover it and report it. First step, you have to let it bleed. Second, wash it with soap under running water. Cover it with waterproof dressing and report it. Contact the nearest accidental and emergency as soon as possible following the needle stick injury. Sharp that frequently cause injury. Hypodermic needles, blood collection needles, needles used in IV delivery systems, glass capillary tubes, used disposable razors, sharps that frequently cause injury. Who is at risk? Nurses, lab technicians, phlebotomists, housekeepers, laundry personnel and others. Procedures linked to injuries. Procedure like drawing blood, IV access, handling laundry, collecting filled sharp containers and more. Methods to reduce exposure. First step, follow standard precautions. Second step, use engineering and work practice controls. Third, wear personal protective equipment. And fourth, avoid recapping, bending or breaking of needles and sharps. Standard precautions. CDC recommends standard precautions. Assume all blood and body fluid are infectious. Every patient is treated as potentially infected with a blood-borne pathogen. All healthcare workers must use standard precautions whenever there is a chance of exposure to blood or other potential infectious material. Workers must use hand hygiene. Safe practices. Avoid recapping, bending or breaking needles and sharps. Use a one-hand technique if medical procedure requires recapping. Place used sharp immediately into puncture-resistant containers. Carry sealed specimen containers in an outer container. Avoid touching contaminated broken glass with bare hands. Exposure incident. Report all exposures. Complete necessary paperwork to help document exposure. Employer will provide a medical evaluation, counseling, treatment, information, etc. as needed for you. Post-exposure procedure. Steps or the actions to be taken. At the time of needle stick injury or exposure to blood and body fluid, skin or mucous membrane. Wash the part with soap and water immediately. Without delay, proceed to OPD. Give full history of injury or exposure. Give history of hepatitis B immunization. Give your blood for testing. Give history of source, patient and his blood test findings if known. Submit his blood for testing of HBsAg, anti-HCV, HIV antibodies. Inform your director and section in charge. Start the antiviral treatment immediately. Show all your reports and to follow up within 24 hours. In case of HIV sources, do follow up with the concerned physician within 24 hours. Injury for further treatment, evaluation and management. Post-exposure prophylaxis. First aid, risk assessment, counseling. Post-exposure prophylaxis drugs 4 weeks depending upon risk assessment. Relevant lab investigation on informed consent of the source and exposed person and follow up and support. Thank you. I hope you liked this video. Thank you for watching.